Good morning. Hey, it's Monday morning. It's just after 10 o'clock. It's actually 10:15, and we have an exciting show lined up for you today. If you're watching on social media, you're going back and listening on Apple, Spotify, however you get your podcast, feel free to let us know. Share this link out. We're going to be talking to some of the fine individuals at HCA Houston Healthcare Mainland. We have CEO Jim Russell. He's just been put in place. We're going to find out how soon, and the things that have been taking place while he's been put in this brand new position for himself. And we're also going to have Dr. Candace Dunn. I'm going to kick this on the FM, and I'm going to get them introduced. Here we go. Good morning. This is KHEA Radio, 99.5 FM. It's 10:16. This is Kickstart. My name is Gardy. If you're watching on Facebook, smash the share button. If you have any questions, feel free to let me know. We're going to be talking to the CEO of HCA Houston Healthcare Mainland, Jim Russell. We're also going to be talking to Dr. Candace Dunn. So I'm going to go ahead and bring them in and see how they're going. So first, we're going to have Jim Russell. He is the CEO. Jim Russell, how are you doing today, sir?
Hey, I'm doing great, Gardy. Good morning to you and all of your listeners. And thank you for having us on this morning. Really appreciate the time and getting to meet you over video. I heard a lot of great things about you and your program. So thank you very much for having us this morning.
Yes, sir. Thank you for taking your time and doing that. You've been in place not that long. How long have you been in that current CEO position?
Sure. So I've been here since March 23rd. I've had the privilege of serving as the Chief Executive Officer here at HCA Houston Healthcare Mainland. And I've got to tell you, it's been an incredible transition for me. This hospital has an incredible team of nurses and other healthcare providers through lab and respiratory and EVS and fans, and then just the wonderful relationship and affiliation that we have with our physicians here. It's been a great transition for me.
What position did you come from?
I came from Clear Lake, Gardy. I was at Clear Lake as the Chief Operating Officer for a year from HCA Houston Healthcare Clear Lake. Prior to that, I was at the Women's Hospital of Texas. Before that, I was in North Texas at hospitals there with HCA. I've actually been with HCA for about 22 years now. I started as a technician in the operating room. While I was going to nursing school, I'm the CEO here, but I'm a nurse at heart and was an OR nurse for a long time and had the great opportunity to take care of patients. It was one of the things that brought me the most joy and satisfaction in my life, was taking care of people every day, keeping them safe. And now as the CEO, I still get to do that, but I get to in a different kind of way because I get to take care of people that take care of people. So I still get that same joy and great satisfaction in this position as well.
Is that the normal? I'm sorry, but is that the normal route? You know, being a nurse, being in the operating room, being a technician, and next, 22 years later, you become the CEO. Is that normal?
No, that's a little bit of a different route. It's outside of the normal route that a lot of the COOs and CEOs take, and we have a lot of great leaders within our company that are and are not nurses. A lot of CEOs that are not nurses. Probably the majority of them are not. But most of them come up through a healthcare administration route, go to, get their bachelor's degree, their master's degree, go to work in hospitals, and then learn operations from the ground up. So while I learned operations from the ground up as a nurse, that was my background. Others learn the operation side, from a different perspective. But ultimately, we end up in the same place, and that's having the opportunity to lead a hospital and make sure that we're doing everything that we can to take great care of people every day.
So right now, there's COVID-19, the coronavirus. There's a lot of different headlines going on and, people wondering, hey, is it safe to go to the emergency room if I have something going on, or do I really need to go? What measures are y'all taking there at the hospital, and is it safe for somebody just to go?
Absolutely. Well, first of all, let me say it's absolutely safe for somebody to come to the hospital. And I think, honestly, the not coming to the hospital is really more scary than coming to the hospital, because if you feel like you need to come to the hospital, then you're already having a medical need that you need to have taken care of. And if somewhere in that thought process you're thinking maybe I shouldn't go because of COVID, now you're delaying medical care that you need to keep you healthy and in many cases alive. And that situation will just continue to deteriorate for you clinically, and then it's going to become an emergency and it's just going to be worse. We have lots of structure, processes that we've put in place at our hospitals that are very prescriptive about how our patients come into the hospital. There's one entrance that our team members come into. They're screened there. Any of our patients that come in are screened there. Their temperatures are taken. They're asked a series of questions. They do hand sanitization, and they're given a mask. But we are a level 3 hospital, so we don't have visitors in right now. We are doing outpatient elective procedures, and we're able to take great care of those patients and keep them safe. And I think the important thing too is that we do have, like every other hospital, we have COVID positive patients in our hospital, but we have very specific way that they move from the ED. We'll go out in front of that patient and make sure that no one is in that pathway. We have only one elevator that we use for those patients that nobody else uses. They go up to a floor that only COVID positive patients are on. We have great physicians, and our lead physician, Dr. Dunn, that you'll speak to here in just a second, who only take care of these patients. They don't go back and forth between patients. Our team members, our great nurses and other healthcare providers in the hospital only take care of those patients. They don't move back and forth. They have the opportunity to shower, and we provide clean scrubs for them to wear when they leave, so that they're leaving clean and in clean scrubs, so they're not potentially cross-contaminating anything out of the hospital. So we have lots of systems in place, lots of processes in place to make sure that we're keeping everybody safe when they come in the hospital. And I think no matter what else you hear today, or your listeners hear today before we finish up, is please, if you need medical care, don't delay coming to the hospital. It is a very safe place, probably still one of the safest places to be. And we can take care of you here, make sure that we can get you well here, we can keep you safe here.
That's good to hear. So my son, he was born that second week of March. I think it was March 13th, and that was but he was at Clear Lake at HCA Houston Healthcare Clear Lake, and just seeing the precautions that were being taken, the screening at the door and making sure people sanitized, and it was an interesting time. But I could definitely see the measures that were being taken, and talking to my wife about it, because he spent about 2 weeks in the NICU. That was probably the safest place for him to be, other than being home, but we didn't have any concerns about contamination and all that other stuff that's a possibility. But are people able to get tested for COVID-19 at the hospital? Where can people get tested?
So that's a great question. So first of all, let me tell you that I hope your son is doing well. I bet it sounds like he's doing great. Everything went well. They took great care of you at that hospital. I know what a great hospital it is, what a great NICU that is, and how they take care of really our smallest set of patients, and the great job they do with those patients and their families. Yes, so if you come into our ED symptomatic for COVID-19, we're going to test you. Whether we admit you or send you home, we're going to test you. And within the ED, we have separate spaces. So those that come in that are symptomatic for COVID, we have a place in the ED for them. It's separate, completely separated by a hallway from our main ED, where patients that are coming in to get care that are not COVID symptomatic get taken care of. We will test you there. And also, our HCA affiliated Care Now urgent care centers are testing in the community. So if your listeners want to be tested, they can contact one of those urgent care now urgent care centers, and follow up with them about how they can get in and get tested.
All right. So that makes it, it seems like testing is more available than it was at the beginning. So there's Absolutely. Options.
Yes, sir.
And we also have Dr. Dunn with us this morning. Can you share a little bit about Dr. Dunn before we chat with her for a bit?
So Dr. Dunn is an incredible physician leader, incredible physician partner, and takes great care of her patients every single day. It's what she chooses to do every day. And I'm very proud to know her and be associated with her. And she is our lead COVID hospital, in-hospital physician that oversees the care for our COVID positive patients.
All right. Dr. Dunn, how you doing this morning?
Good. How are you doing?
I'm doing really good. So you're coming to us from the mainland location as well, right?
Yeah, we're in similar spaces here, Jim and I.
Yeah.
Congrats on the baby.
Thank you. He's doing so good. He's doing really well.
Good.
Yeah, and the people there at the Clear Lake location, they were awesome. Answered all our questions, going above and beyond. Thankful for all of the team and staff there. And if it was a different time, and I know that they weren't on lockdown, I would love to interview someone and just talk about that. Everything that they do there. But so, Dr. Dunn, can you tell us a little bit about yourself? Where are you from, and how did you end up on this path to being, there at Mainland?
So I grew up here in League City. I was born and raised here, left for college, came back, knew I was going to come back the whole time, knew my whole life I was going to be a physician. So went down that path, lived in Dallas for a little bit, went to Texas Tech for med school, which was awesome if there's any Red Raiders out there. But ultimately knew I wanted to come home and work with, my people. So
yeah,
coming home and being able to take care of the community that's just been something that was going to happen no matter what. I've been with Mainland for about a year now, and never ever could I have ever anticipated this happening and this being where we're at today. But like Jim says, I'm here just about every day and have been since about March 13th. And it's a privilege to be able to help, because this is just crazy, unprecedented times.
Mm-hmm. You mentioned you never imagined being able, like, for us being in this, like this being real life, right?
Yeah, I'm young, we haven't had anything like this. The last pandemic was a really long time ago. And you don't train for this. You don't talk about it in medical school. It's a possibility. Flu season every year is hard, but this is just something I don't think anyone still knows what to do with. Would you just do the best you absolutely can?
Mm-hmm. So if somebody comes in, they test positive, I mean, what happens? Like, what are the steps that y'all do? What are y'all how are y'all treating them?
Yeah. So like Jim said, the first and foremost is to get them, if you come in with respiratory symptoms, you're going to be put on that side of the emergency room. And then we have a specialized way of getting them up to the floor if they're going to stay in the hospital. So they'll be my patient. If you have COVID and you're here, you're mine. And if you're sick enough to be in the ICU, you'll also have a pulmonologist taking care of you. If you're on the floor, it'll be me. And the biggest thing is oxygen. So these people just need oxygen. That being said, of all the medications that you've seen in the news and heard about, we do have them here for patients if they're indicated and if needed. So we do have the antiviral medication. We have the hydroxychloroquine. We have anything and everything that everyone around the world is using to treat these patients.
Mm-hmm. And are those working? Are those medications working? Is it just depend on what y'all see and kind of just monitoring, or does it work?
Obviously this is the most common question I get. Some of them work, some of them don't. It really depends on the person. That's the weirdest thing about this virus is it's different in every single person. It can be from completely asymptomatic to, a life-threatening situation. But we do see positive results a lot. And we're using the antivirals. We have convalescent plasma, IL-6 inhibitors, and they all do something. It's at this point, if I had the answer to that, I would have written a paper already, right? And everybody would be calling me, but nobody really knows what's helping and what's not. But hopefully we find that the antiviral and the IL-6 inhibitors are helping.
Yeah, and this is
oxygen helps.
Mm-hmm.
I'll say that.
That's the one thing for sure, because people they're struggling to breathe. Oxygen is the answer. Yeah. Should more people get tested? I know that there has been, like you mentioned just now, like a lot of people are systematic. It affects everybody differently. I even saw reporters like people are feeling tingling in their toes. It could be a sign of COVID-19. Should more people get tested, even if they aren't showing symptoms?
So that's a really hard question to answer. I think the easy answer is yes, but the easy answer is also, what are you going to do with that information? If you're asymptomatic and you get tested, Is it going to change what you do on a day-to-day basis? I think everybody should still be washing their hands and wearing a mask when you're out in public and staying safe and social distancing. So even with that test result, I'm not sure it should change day-to-day what you're doing, if you're doing those things. Does that make sense?
It does, yes.
Yeah.
Are there any positive stories? Because I've seen some stuff come from different hospitals.
Yes.
Like,
Yes. So, you know, the people who come in and are on the ventilator, and it's awful and it's sad, and their families can't be here with them, and we're FaceTiming them and calling them every day. The best feeling in the world is when they get off the ventilator and they FaceTime their families. And we've had this happen numerous times. But we've also had a man who we had here, and I just love him. He's the funniest thing. The only thing he was worried about before we put him on the ventilator was he didn't want anyone to see his behind in his like his butt.
That's fair.
And I'm like, oh my gosh, this is the least of your issues. So he was on he was on life support for, I want to say 28 days. And we got him off and we got him up to rehab and we got him home. And his entire family was outside wearing masks. And we just had this big parade for him with everyone in the hospital who had taken care of him. And it meant everything to him. And we've done this numerous times now. So there are really, really good stories that come from this. And I think people have learned to come together. And I think everyone that is able to be a part of this now appreciates what we do even more than before.
Hey, Gardy.
Yes, sir.
I just wanted to say too about that event where we clapped that gentleman out when he was discharged. We know our team members lined the hallways as he was leaving and clapping. And it was a very emotional moment, not just for him, but for everybody that works here. It was very impactful to everybody here as well. So it was a wonderful moment. I think it's on Facebook. I think you can find it and watch that event. It was incredible for us.
Yeah, I know I saw something on social media on Facebook. I'm gonna have to find that again, and we'll definitely share it out because it's powerful. And just to see somebody come back to life pretty much. And that's what you guys are doing and helping with.
Yeah,
absolutely. Lots of success stories.
Yes. Hey, is there anything else that y'all would like to share while y'all are on today?
I just wanted to add to what Jim said previously. You know, in the beginning with the social distancing and staying home and staying safe, we're starting to notice a lot of people aren't leaving their houses to get the care they need. And it's so important for people to talk to their PCPs, even if it's on telehealth visits. Please, please, please come to the emergency room. It is safe here if you feel that you need to. I have a hard time because COVID's very important. I take care of only COVID patients, but we are not forgetting about everybody else that needs care. We want to help take care of them too.
Can you also remind people what are the tips that they should be doing? If, what's the safest way if you have to leave your house? What should you be doing?
Like to come to the emergency room?
Well, not necessarily. Just like to go to the store if you have to. Anywhere.
Okay, so wear a mask, wash your hands. Guys, don't wear gloves. The gloves are worse than the hands. Just wash your hands. Gloves actually get more contaminated and you don't wash the gloves. Social distance. What else, Jim?
Those are the key things.
Those are the key things. If you're sick, stay home.
Yes. Yeah. If you have any symptoms at all, stay home. And I think those things that Dr. Dunn mentioned are the key things that you can do that keeps you safe, but keeps everybody else safe as well. And those are all things that we do here in the hospital and throughout the hospital. Constantly, we wear masks. Anybody in the hospital has a mask on while they're here, and we've got hand sanitizer everywhere, and we're washing our hands constantly. It's our, we're obligated, we're accountable, and we feel very responsible for the people that are in our hospital.
Yeah,
and I would just say, Gardy, before we go, just the one last thing that I want to make sure that we say again, and Dr. Dunn alluded to it, was the risk associated with avoiding hospitals and ERs when you're sick right now far more outweigh any potential risk exposure. We keep people very safe, and even in our hospital today, the number of patients that we have in our hospital, the COVID positive patients are only 11% of the total number of patients that we have in house today, and all of those. The COVID positive patients plus all of those other patients are safe. They're safe. They're separated. Our COVID positive patients are isolated and safe and being well taken care of. But please, 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 we would love for everybody that needs care to come to HCA Houston Healthcare Mainland, because I know the type and quality of care that we can provide here, these patients. But if not here and you need medical care, please, please, please go somewhere and make sure that you're getting taken care of.
All right. Well, thank you all for hanging out today. We've been talking to Jim Russell, the CEO. We've also been talking to Dr. Candace Dunn there as well at the Mainland location, HCA Houston Healthcare Mainland. This is KHEA Radio 99.5 FM. If you're watching this on social media, feel free to ask any questions. And I'm sure that the team there at HCA, they've been very responsive, that they'll be able to answer those, or I'll get those sent to the right person. This is KHEA Kickstart. All right, Facebook. Hey, y'all be good. Have a good day. Be blessed.